So Ruby, our 11-year-old on the way to school, asked, when do we start wearing masks? And everybody is asking, do we need to go out and buy masks? Hey guys, it's Aaron Ball with the daily coronavirus health update. I'm doing this once a day during the week for 30 days just to inform family and friends in our community about what they can do to stay healthy, debunk some of the things that might be going around that aren't true, and also really share as things develop news, but not just bad news, good news as well. The first thing that Ruby asked this morning as we were riding into school is, do we need to start wearing masks, and if so, when? The short answer to that question is masks are not recommended by the CDC.
The CDC says wearing a face mask to protect yourself from this new coronavirus is actually not recommended.
It is unnecessary. As we said, in the United States, the risk to any individual American is extremely low.
That's because there's not much evidence that face masks benefit the general population. Dr. Frank Esper is a pediatric infectious diseases doctor at the Cleveland Clinic. He says it's really the sick person that should wear a face mask.
If they are feeling like they have symptoms, we do ask them to put on a mask when they're coming to waiting rooms or the emergency department or when they're going into a public space. It helps prevent the spread of infection.
In fact, face masks are not recommended even during the throes of the flu season. Experts say there are better steps to stay healthy.
So wearing a mask when you don't have symptoms is not really that helpful. What is helpful, though, is washing your hands.
And also, try not to touch your eyes, nose, and mouth because viruses can spread easily from common surfaces.
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick.
Soft surgical masks, like the one shown here, are designed to prevent the wearer from spreading their germs to others, but they won't prevent inhalation of airborne germs. Their loose sides reduce their effectiveness as a barrier against disease. To block out the greatest number of airborne germs, you'd need an N95 respirator mask. This mask is what a surgeon would wear around a patient with a highly infectious disease like tuberculosis. These masks aren't a foolproof solution for the public either. Surgeons get their masks fitted and generally only wear them for a short period of time. Just buying a mask from the drugstore wouldn't give you the same snug fit around the mouth that keeps those germs from getting in.
So if you want to and feel better, go buy an N95 mask if you can find them. They're mostly sold out. I'm going to link a valuable article that I read by Bill Gates in the description below. It's on his blog, and it's about epidemics and how we learn from this. I also read an article sent to me by Ann Kelly about some shortages in medicines because of the supply chain from China. So I'll link that in the description below. It's important that if you are on medication, you get it now, and also stock up on any provisions that you may need if we choose to self-quarantine and isolate, do that social distancing over a week or 2 week period. It's important to plan ahead now.
I would not be surprised if certain communities around the country, maybe even in near Seattle, where we've been talking about these most recent cases, we start to hear about what are called social distancing recommendations, which is what all these closures are all about, trying to separate people so that they become less of a threat or a risk to each other. Schools could be closed. They got a plan for that.
It's interesting, those schools, kids have not been shown to be at serious risk, but the idea is that they can get it and pass it very easily.
They can be sort of vectors, so to speak, of this. But schools, workplaces, you know, people may be encouraged to work from home as much as possible. So big mass gatherings, things like that. People are encouraged to go get their flu shot so as not to commingle the flu with this. You may, people, you look around your house and you say, if I need to be home for a couple of weeks, do I have everything I need in the house in terms of medications, food, water, the basics? That's not something we're used to hearing in the United States.
There are now cases of the potentially deadly virus in 12 different states.
And that includes New York, which just confirmed its first case in New York City. Officials say a female healthcare worker in her 30s is isolated in her Manhattan home after contracting the virus in Iran. America is one of at least 67 countries with coronavirus. Italy has been hit especially hard, and Charlie D'Agata is there for us in Rome. Charlie, good morning. What are you seeing?
Good morning. Well, it's kind of what we're not seeing, and that's a ton of tourists outside the Colosseum, which would normally be heaving. Now, hotels are empty, too, and we're now hearing that the first case has been detected here in Rome. Here's what Venice looks like now, not much more than a week after many were aware the coronavirus had arrived. The number of cases in Italy soared by 50% on Sunday to more than 1,700. People have even been worried about the health of Pope Francis, who had to pause to cough a couple of times during yesterday's prayers. Vatican officials tell us His Holiness just has a pretty bad cold. At a time where many people are a little bit worried about gathering in large crowds for fear of spreading the virus, the numbers here seem a lot lighter than usual.
The distinction here is between what they think is likely, that's actually their best case scenario, and what they think could happen if the disease isn't contained elsewhere. Look at North America. Small projection if things stay contained. If they don't, you've got a big fall, a very big fall indeed. And over here in Europe, and obviously this includes the UK as well, the expectation is only a small fall in GDP. But if the disease is not contained, by the way, this is their best case scenario, relatively small, if the disease is not contained, then essentially you've got recessions all across Europe.
I'll leave you with good news that I'm hearing from the World Health Organization conference call and other news sources. They're saying that containment and fighting this will make an impact. So while this is likely to spread and disrupt our economies here in the near term, hopefully we'll rebound during the spring and the summer and be able to see real relief from this. In the meantime, stay connected and stay informed, and most of all, stay healthy.